Hello, my name is Carrie Rice. I'm part of the Maine CDC Healthcare Epidemiology Program, and today we are going to be discussing COVID-19 infection prevention and control as it relates to the environment, rounding, and personal protective equipment. So let's talk a little bit about the environment of care. And so when we think about infection prevention and control, why is the environment important? It's important because it can represent a source of pathogens or germs that can cause infections and or may carry antibiotic resistance. And so when we look at the environment and we think about transmission on how it might reach a patient, resident, or client, or a healthcare worker, the environment can be either a primary source of germs, such as a contaminated sink or water source, and other times it can be an indirect source. An example can be, say, when you have a contaminated surface or piece of equipment and it is handled by the hands of a healthcare worker who fails to wash their hands appropriately and then may touch a subsequent patient, resident, or client, or may touch or handle a subsequent environmental surface and may leave that germ or pathogen that they picked up on that next surface or individual. And so we think about this, contaminations of surfaces such as those as high touch areas or pieces of equipment that may be used from patient to patient, resident to resident, etc. If if it is not cleaned and disinfected appropriately, it could harbor germs that we don't want to spread to another patient, resident, or client. And so that is why it is important when we think about environmental cleaning and disinfection and when we think about hand hygiene. And so below you'll see just a little diagram that kind of shows the travel that you might have with transmission when we're thinking about the environment and if you have a patient, resident, or client that is either currently colonized or infected with whatever organism you might be looking at and how it might transfer to another patient, resident, or client. It's a nice little pictograph. And so what is important when I think about infection prevention and control in the environment? An important thing to be ongoing performing is rounding. And so rounding or auditing, as it might be called, is a form of process surveillance to identify if your environment of care is being maintained for safety and that your staff or healthcare workers are actively implementing best practices or policies. This rounding or auditing you can use to collect data, document findings, and to monitor for trends. You can use it to provide direct feedback and education at the point in time that at delivery that you are performing that rounding. And it is also important to remember to vary the times and shifts that the auditing is performed and that leadership should be participating in this rounding. It takes a village. The more individuals that you have participating in rounding offers you a couple different benefits. One, you can perform more rounding. You can reach different times and different shifts to see if you have any differences in how things are performed during day versus evening versus a night shift. It also shows engagement. And so if it's more than just the infection preventionist or the safety or whoever the designated person is, and you involve leadership, it shows that this is important, it's at the forefront, and that you're working as a team. And so what are the things that can be included in rounding? Well, when we think specific to COVID-19, there are many different things that you may want to go out and round on to ensure best practices are being implemented. I have a list included here of some examples. This is not all inclusive, it just gives you some ideas, and so I'll point some out. So is PPE ready available? When you go out and you look at the units, do you notice that staff have easy access to PPE? It's there and readily available for when they need it. Is it being donned and doffed, which means put on and taken off appropriately per your expectations and your training? If there's extended use or limited reuse being practiced, is it being stored appropriately? Is it, again, being donned and doffed in a manner to prevent contamination? Things also to include could be looking at your source control and physical distancing. Is it being maintained? Hand hygiene being performed? How are your supplies stored? Are people making sure to remove their gloves and perform hand hygiene when they reach into supply storage, a large bin before they go and grab so they're not cross-transmitting anything to the other supplies within that cart? Where is it stored? Cleanliness, observe cleaning and disinfection practices and really watch to see, are your non-critical pieces of equipment, which I'll talk a little bit about later, or your high touch areas, your daily room cleans? Is it being cleaned to expectation? Are your staff following the guidelines and protocols that you may have put in place? And so when you think about this, you just might sit and go, there's too much. There's so much to look at and so much to do. There's no way I can go out and round and look at all this. So this is where you can take a step back and do a risk assessment. Determine out of the things that maybe you're rounding on might take priority, or vary and monitor each time you go out. So maybe you go out one time and you focus on cleaning and disinfection and hand hygiene. Maybe the next time you go out and round, you focus on your PPE donning and doffing, or just general overall safety and care of the environment. And maybe you have identified by collecting data, documenting your findings, that there's a trend and that you're having an issue in one area. And so you want to continue to focus on that for a little while. So there's no right or wrong way to do this. It's just ensuring that this is part of your ongoing process. And it's going to help you to identify those areas that you may need to spend some time and do some re-education, or actually implement some process measures, or some ongoing performance improvement. And so let's talk a little bit about cleaning and disinfection. Cleaning and disinfection environmental surfaces and equipment is a fundamental practice in reducing their potential to cause a healthcare associated infection. So we go back and think about that first slide. Cleaning and disinfection is one of those things that we can do to what we call break the chain of infection and stop any transmission and a subsequent infection. Minimally, equipment should be cleaned and disinfected before use on another patient, resident, or client, and prior to storage. Looking at your processes, you want to make sure that that equipment, that you have a process, that it is not going to get to another patient, resident, or client before it has been cleaned or disinfected. And when I talk about equipment, I'm referencing non-critical equipment. So that equipment that comes in contact with intact skin but not mucous membranes. And so examples: stethoscopes, automated blood pressure machines, blood pressure cuffs, anything that's going to go into the patient, resident, client environment, be removed and go on to someone else, are going to be stored. You want to ensure that you have a process to make sure that, one, that doesn't go to another individual and does not go to storage before it has been cleaned or disinfected. The other thing you want to think about is your disinfectants. You want to ensure that your staff are aware of the prescribed wet time, or might be known as contact time. And so what this is the amount of time equipment must remain visibly wet and cannot dry for the product to be effective. And times vary based on product. And so you might be using a pop-up disinfectant wipe, or maybe a prepared solution, and you really need to be aware of those times. Otherwise, your product is not going to be effective in eradicating those organisms that it lists on its claim list. And a fact to know is a surface wiped with a disinfectant and left to air dry usually will dry within 1 minute. And there's dependencies upon this, upon temperature and humidity. So again, just really, when you're out monitoring cleaning and disinfection, you want to look at the cleaning. And if you know that your product has a 1 minute wet time, are you looking to see that in the way that the healthcare workers or staff are applying that product, is it staying wet for a full minute? Or if it's 3 minutes, 10 minutes? And you might be surprised when you look at these times at how long some of the wet times are for certain products. The other thing we think about cleaning and disinfection in the environment is review your environment needs and look at the awareness. Is there any need for increased cleaning on top of your daily routine cleaning? Is once a day enough? Think about high touch areas such as nursing stations, common areas. How often, and are they cleaned and disinfected? Who is responsible for the cleaning and disinfecting? And then when you're looking at staff who are performing this practice, you want to make sure they're educated and trained on the specific processes and the wet times that they are using. And this would also hold true for if you have staff that are helping out in the times of COVID-19, that maybe it's not their routine practice to perform a routine daily room clean, but they're helping out the environmental services, or they're those, say, nurses or nursing support on the unit are being utilized to do this cleaning to decrease the amount of people going on to, say, a COVID quarantine or COVID isolated unit. You want to make sure that they have received the same training that you would have given to your environmental services, so you're not having a different standard of care, and that those expectations are being met so you don't have any buildup of bioburden in that environment. And so just really looking at this overall process, and this could be something when you go out and round, a very focused, specific rounding that you do that maybe isn't part of your routine weekly rounding, but maybe it's more of a focus thing that you do. But just something to keep in mind. It is important as we think about COVID-19, but it's also important outside of COVID-19 to ensure that we are providing a clean and safe environment for our patients, residents, and clients. So the next couple of slides, we're going to talk a little bit about room turnovers in COVID-19. And a part of this, it's about air exchanges and air clearance. So first, I want to talk a little bit about air clearance and what exactly does this mean? And so this is a process where you would delay the entry into a room until time has elapsed for enough air exchanges or air turnover to have occurred to remove any potentially infectious particles such as tuberculosis, COVID-19, etc. So this is a process you would use at any point in time. You might be implementing airborne transmission-based precautions, and you're looking at the appropriate of turning over that air clearance, that airspace within the room. Now, the CDC HIPAC does offer some guidelines. You can see that in the chart to the left-hand side here, where based on the number of air exchanges you have per hour in your space, it looks at the amount of time that you would need per that air exchange per hour for that air clearance, air turnover to have occurred. And so as you can see, for example, if you have a room or a space that has 2 air exchanges per hour for 99.9% efficiency, you need 207 minutes. So we look at this when we're looking to do room turnovers, replacement of another individuals into a space. And so it is helpful to know these specific air exchanges per hour within your facility to help in the implementation of moving patients around, moving residents around, and also knowing when it's appropriate to go in and clean and etc. And we're going to talk about that a little bit more. Noting that whenever you have a patient, resident, or client that is on airborne transmission, whether it be for COVID-19, to be for tuberculosis, etc., while they are still habitating that space, you need to wear the appropriate level of PPE, including an N95 respirator higher, while you're in that space and as they continue to habitate it. When they have left, transferred, discharged, moved from that area or space, before you can enter that room without wearing appropriate PPE based on clinical situation and or looking to place another individual into that space, you need to have that closure time to allow for these air exchanges to occur. In addition, you want to have these air exchanges occur so that anything that might be suspended in the air can fall if it's going to fall, and you want to do the cleaning after that so that you don't have anything falling onto surfaces after you've already gone in and cleaned. And so this is something you should be aware of for your facilities in COVID times and outside of COVID times. It can take a little bit of work. You likely will need to work with your HVAC expert or your facilities manager to kind of look at what are my air exchanges throughout my facility. It can vary dependent upon. So you may have a unit that might have, those rooms in that room have 6 air exchanges per hour. You might have another unit that has 2. You could also have a time where maybe you have 2 rooms within that space that has 2, and you have 2 rooms within that unit that have 6. And it's nice to have some sort of reference that staff can easily access and know these times, so when they are looking to do any movement of patients, residents, or clients, that they know the proper times they should be implementing for safety of both the patients, residents, clients, and safety of staff. So they know what PPE is appropriate based on the situation. So this is just a little bit of background information around this process if you had not heard of this before. There's a link down at the bottom of the slide where you can get more information. I just wanted to give a brief overview. So next, let's talk about a little bit of these air exchanges and room turnover specific to COVID-19. So if you have a COVID-19 quarantined or isolated person and you have transferred them out of that room, that space that they are in, or they've been discharged, Prior to putting any other patient, resident, or client within that room, and prior to entering that room without the appropriate level of PPE, it needs to have this room shut down that we talked about based on the air exchanges per hour of that space. Full PPE should continue to be worn in that space until that specified time has elapsed, and if the person continues to habitate that space. Next, after that time has elapsed, you can go in and clean and disinfect those surfaces utilizing a disinfectant that is effective against COVID-19 after that room shutdown has occurred, noting that it is federal CDC recommendation that minimally sourced controls such as a face mask. Now, also it would be eye protection if you happen to be in an area of higher community transmission based off of some other guidelines that you can see within the state, as well as gowns and gloves when you're performing terminal cleaning. Noting if you are in an area where eye protection is not included as a part of source control, it would still be recommended to wear eye protection if there is anticipation of splashes or sprays during the cleaning and disinfection process. And so just noting that this is what is recommended when you're cleaning a quarantined or isolated COVID-19 individual's room. So then let's talk a little bit about aerosol generating procedures during the times of COVID-19. So it is currently recommended right now that for any patient, resident, or client, if they are receiving an aerosol generating procedure, such as a nebulizer, CPR, etc., healthcare workers should wear an N95, gowns, gloves, and eye protection while they are in the space during the performance of and after completion of the AGP until the specified time has elapsed for that area or space. Additionally, you should be keeping the door closed while that AGP is being conducted until that time has elapsed. It is also a good idea to place some signage outside of the space that an AGP is being performed and to have the time written on that sign when it would be appropriate to enter that space without having that level of PPE. Noting if it's an individual who is on COVID-19 precautions for quarantine or isolation, the recommended level of PPE for that situation would still be continued. But you very well could have a patient, resident, or client who is not on any type of COVID precautions, but they might be receiving, say, a nebulizer. And so you would have to implement these level of precautions during the active delivery of that AGP and then up until that time has elapsed as well. When you're turning a room over, so let's say you have a patient, resident, or client that you've put in the space to deliver their AGP, but they're not going to habitate that space after, then you would want to shut that room down prior to the cleaning and disinfection and use of another patient, again, based on what you need for the time of air exchanges of that particular space. And you would still then want to wait for the amount of elapsed time before you did the terminal clean of that space as well. And then also remember to clean and disinfect utilizing the appropriate disinfectant that is effective against COVID-19. So this is a lot of information in 2 slides. Would recommend reading through them one more time. If you have any specific questions, you can reach out to us and we're happy to help clarify. But we just wanted to point out some of these specifics as it relates to COVID-19 quarantined isolated persons, and if you are performing aerosol generating procedures, because it can get kind of confusing in understanding that there's a little bit of enhanced guidance for practices around aerosol generating procedures, regardless of that individual's COVID-19 positivity or quarantined nature. So I now just wanted to give a little bit of a plug as a reminder of the importance of hand hygiene. So hand hygiene is one of the gold star infection prevention methods to stop the direct or indirect transfer of any potentially infectious organisms. Healthcare personnel should be using either an alcohol-based hand rub or washing with soap and water per guidelines when dealing and many different interactions for patient resident clients and or interactions with environment. And just wanted to highlight one important thing. Find that staff are very good at understanding the importance of performing hand hygiene prior to entering a room prior to a patient-resident client interaction and the importance of hand hygiene after that interaction has completed. However, just remembering that there may be times it is warranted during that interaction that additional hand hygiene should be performed. The World Health Organization, or the WHO, does offer some nice pictures and diagrams that kind of demonstrate this, and they call it their 5 moments of hand hygiene. And so I'm not going to go through all of this information of clinical indications for hand hygiene or the 5 moments, but just pointing out the importance of always highlighting with staff why hand hygiene is important, when hand hygiene should be occurred, and also when you're doing your rounding and watching for the application of hand hygiene. Are they doing it appropriately? Is there opportunity for more education? Are they missing some moments of hand hygiene, missing some opportunities where it could have been performed? And so this is something that is important during COVID-19, but is also important in everyday infection prevention practices. So next, let's talk a little bit about personal protective equipment. So personal protective equipment are things that we can use in healthcare, and they're designed to protect the person who is wearing it, their skin, their eyes, their mucous membranes, their airways, and potentially clothing from coming in contact with potentially infectious agents. It can help protect someone from respiratory droplets. It can help protect from contaminated material, microorganisms. It helps when we're dealing with multi-drug resistant organisms. PPE includes gloves, face masks, protective eyewear, face shields, and gowns. And when we look at PPE, what is important to know is thinking about the situation that I'm going into and what do I anticipate may happen during that care. You don't necessarily need a sign above the door that says a type of transmission-based isolation precautions to necessitate the need to wear PPE. And so staff and healthcare providers should understand and be aware of those times when PPE may be indicated to ensure that they are protecting themselves appropriately. Additionally, each facility should know what their personal protective equipment capacity is. And this is something that has been very important in and throughout the pandemic. Prior to the pandemic, there wasn't really a large struggle with PPE supply and shortages. And so when we are in the midst of a supply shortage, we should first look at what our supply looks like at our facility. And that is because there's 3 different types of capacity. There's conventional capacity, which is basically when we're not in the midst of a shortage, there's no issue with our PPE supply. And in this, PPE is discarded after each client, resident, or patient interaction. And then there's contingency capacity and crisis capacity. When you determine your capacity, and you happen to be in either contingency or crisis capacity, is when you may look at the supply shortage strategies that fall within each of these different capacities. So for example, extended use of PPE, such as an N95, is a contingency capacity strategy. Limited reuse of PPE is a crisis capacity strategy. And so when a facility is looking at adopting one of these strategies, it really should go along with where you are in your PPE capacity. So if you are in conventional capacity, it doesn't mean that you automatically start implementing the practices of limited reuse of N95s. And so that would be wearing the N95s for multiple repeated interactions with different patients, residents, or clients under specific circumstances. And so really looking at what is my capacity, what is my supply, do I need to implement any supply strategies? And so kind of understanding this entire process. I do have another additional tutorial which is available. Put the links to it down below on the bottom of the slide. You can find it the same place that you found this tutorial on the Maine Infection Prevention Forum website that goes into respiratory protection and some of these supply crisis strategies. So please take a look at that if you want more detailed information, in addition to the federal CDC website below. Lastly, another important thing when we're selecting our PPE in general is one, like we talked about before, review the situation for the type of anticipated potential exposure. What am I going to be doing? Is the potential for splashing or dealing with large amounts of blood and body fluids? Want to make sure you have a good fit, that it's fitting appropriately. This is very important when you think about wearing your mask, any type of mask. N95s, you have to do a special fit check process. But even your disposable or surgical masks that you are wearing, making sure that those are fitting on the face well. And the CDC does have some additional information that can talk about getting a good fit of your face masks. Then you want to ensure that PPE is the correct durability for the situation. And some examples of this might be, if you're looking at your gowns, do you need a fluid resistant gown? Do you need fluid proof, or do you need either? So in summary, really look at this as an overall, make sure your staff understand the importance of knowing what type of PPE to use in what situation, understanding that you need to know your current PPE supply and how to account for any supply issues and what strategies to implement, and that staff understand this process. This right here, I'm not going to spend a lot of time going over, but I just wanted to provide a little snapshot that talks about the different types of PPE, their purposes, examples of when to wear, some additional information about that, and then again, some further examples of situations or types of PPE that fall within this category. The reason that I employ this here is I have found there's some opportunities to address some gaps in knowledge that staff might have around PPE in general. And so just going back to, there was education and information that was around PPE, and this is what you will see here prior to COVID-19. And it's important to understand those aspects of it as well as how we apply it to COVID-19, because and I'm sure we will get to a point where we are no longer in a pandemic status and we are returning to some type of normal operation, we're going to have to go back to the routine uses of PPE and not these practices that we've employed when looking at these crisis strategies or contingency capacities and that we've needed to maintain due to supply issues. And so just making sure as a reminder that staff understand, what PPE is for, when it's used, and its purpose. So feel free to pause and take a further look at this. You could screenshot and share if it is helpful. So again, this is just a reference page to some of the resources used to create this tutorial. If you have any questions, please feel free to reach out to mecdc.hai@maine.gov. We are happy to answer any questions that you may have. I hope that you have found this tutorial helpful and hope you have a great day. Thank you so much.